me what you see when you look at me. Do you see another brother lost in these streets looking for his soul?
Trying to find my soul.
Or do you see another brother searching for lost souls in these streets? A street soldier.
Street soldier.
Here to help you get that chip off your shoulder, warm your colder days and sober your drunken ways, and find a way to help you get over these hurdles placed in our path. And this is not meant to amuse you. This is for all those who have questions but are afraid to ask.
I won't be afraid. I won't be afraid. No. When times get hard, you lose your way. Open your mind and hear what I say.
This is a message for the hard and the soft. To those who tune in weekly and to those who keep an eye out for 8 p.m. on Sundays and turn their radios off. The truth hurts. The cloth has been pulled. We're walking around half dead. Use this show as your IV. Alive and Free is a new movement. We've achieved self-destruction. A street soldier promotes self-improvement.
Streets couldn't be no colder, so I gotta be a soldier. It shouldn't be this hard for me. Even when it seems so hopeless, I gotta keep my focus. I'm glad to be alive and free, yeah. Streets couldn't be no colder, so I gotta be a soldier. It shouldn't be this hard for me. Even when it seems so hopeless, I gotta keep my focus. I'm glad to be alive and free, yeah.
Welcome back once again, Alive and Free Radio. What do we do here? Play a little music and save a lot of lives. We give that good information, a good advice, a good example, a good instruction, all to make it good in your neighborhood. And if you listen and, you know, apply the stuff we're talking about, it's gonna work out for you. All right, special show tonight. We're gonna talk about all things. We're gonna give you a COVID update tonight. COVID. We're gonna answer any questions you got about COVID. You may have seen stuff recently in the news, and you might be wondering what's going on. You know, do I have to wear a mask again? I saw that Morris Brown recommended that the students wear a mask. They mandated it, right? And I saw a couple of articles. So we got our guy here. We got a guy here in the studio. He has been our COVID expert since this thing kicked off. We got Dr. Andre Campbell, professor of surgery at Zuckerberg Hospital General Hospital in San Francisco General Hospital in the city of San Francisco. We're gonna get to him in a moment, and but we gotta say hi to everybody. Hello, Ann. How are you? Quick. Everybody get quick answers tonight.
Enjoying summer. It's almost over, but yes, definitely enjoyed the water park this weekend.
All right. Lady E.
Hey there, Dr. Marshall. Hey there, street soldiers. And we are delighted that Dr. Campbell is here with us. And I have a special visitor visiting with me from Kansas City, and that's my sister, Marvina Smith Jackson. Oh, wait a minute, hold on. Marvina Jackson. All right. Thank you I'm delighted that you're here with us. Are you going to say anything like, hey there, everybody?
I don't know if her mic is up. Is her mic up? Because I don't think her mic is turned up. It's not turned up. Give her your mic. Give her your mic, lady.
Hey.
Yeah.
Nice to be a part of the party.
You gotta let all the folks back home know where you are.
Yeah,
So
I'm
that
in
you
San
hear.
Francisco visiting Lady Estelle.
And she's treated you well.
And
Yes or no? Quick.
I'm sorry. What was your
And
question?
she's treated you well.
She's treated me like a queen.
That's what I wanted you to say. All right. Okay. Thank you.
Remember that maybe somebody's birthday also.
Okay, let's get it over.
Happy birthday.
Go ahead, say it.
Happy birthday.
Looking pretty good.
All right. Oh,
Thank
all
God.
right.
Hey,
Happy birthday.
hey.
Happy birthday to you. Happy birthday, dear Marvin. I won't say your nickname, even though I know it. Happy birthday to you. All right. Okay. All right. So what's up? We had a little glitch in the beginning. Want to say hi to you? Let's do it real quick. What's up with you? Quick.
What's up, Street Soldiers family? Another Sunday, blessed to be here. What's up, Doc? And like Lady E said, whenever Dr. Campbell talks, we should listen. So Just excited to have him on the air tonight. Plus,
he
he always
is.
looking sharp. He always wearing a tie, by the way.
Yes. Yeah. Well, you know, he.
I got to look official now.
You
It's
always
a
look
high class
official.
establishment, so I got to get
Yes.
serious now.
Yes, sir.
I was mistaken for a security guard downstairs, but I told him I'm a doctor that saves lives. That's what I do, right?
And let me say
All
hi to
right.
Lady E's sister. What's up?
He said,
Nice to have you here in the bed. I hope you're having a good time.
That's Mel.
He's having a good time. All right.
She's having a great time.
Yeah. Let's do these two stories quick because we got a lot to cover with because of the late start here. Listen, wow. Okay. Everybody knows what happened in Jacksonville, right? Yeah. Horrible. A white shooter killed 3 Black people yesterday in Jacksonville in a racially motivated hate crime. Apparently he's 21 years old. I think wasn't that his age? I believe he was 21
20 years old.
Yeah. And
20.
they coming out of he did a dollar store. And he walked in and shot and killed 3 people. There were more shots fired, so we're very fortunate that more people didn't die. But right before that, he was walking on the campus of Edward Waters College in Jacksonville, Florida, historically Black Christian school. And they stopped him and said, show some identification. Why are you here? And he left and then proceeded to do the deed. I guess I don't know how far away from the dollar store is from the college. And then he killed himself. So this is another in a long string of racially motivated attacks on Black folks that have gone back to the beginning. This is the latest one. It is horrible, horrible, horrible. And what's so ironic, everyone, is that tomorrow is the 60th anniversary of the March on Washington. 60 years ago, Dr. King delivered the iconic "I Have a Dream" speech. And let's just put it like this. We still got a whole lot of work to do. It's that simple. Any comment from any of you, and then we'll move on. That's the only two I really want to do, because the juxtaposition of the two are crazy, right? Here it is, 2023, and all right. So you got anything? And not, we'll move on.
Condolences to the family. Obviously, it's just, it's hard to put into words something like that. But I will just say, it's kind of on trend for the world, the country we live in right now. As we continue to see hate crimes increase. Basically since Trump got elected, they've just gone up, 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 and up and up, and they're not going down.
Yeah.
And this is against all kind of groups, but Black people are at the top of as far as victims of these crimes nationwide.
Yeah.
It's clear that this was a racially motivated hate crime, and there was manifestos against people of color on this person's website and in his social media presence, which was terrible. But it's within the last 2 days, there's been 4 mass shootings in the United States. We're now at 470 mass shootings, according to the Gun Violence Archive that keep track of this. 470 mass shootings, more than we've had all of last year, and we're still on a rate that will break another record. So what it is not only that this is a terrible situation, obviously our hearts go out to the people who lost their family, but this is just an absolutely tragic thing. And gun violence really is a public health emergency. And I think until we as a country come to terms with this is something that we need to fix, we're going to see this happening again and again and again. And it's really just a tragic situation in the United States currently.
Hang on to that, because there was a comment from a congressman who was asked, do we have a gun violence problem? He said no, but then I'll come back to that later on. Let me get one good story in. We'll do this. Simone Biles today won her record 8th U.S. gymnastics title, a full decade after her first.
All right.
10
years ago at the age of 16, she won her first. She is 26 years old and better than ever. That is absolutely astounding. Astounding.
That's wonderful.
Congratulations.
Congratulations.
The angel of America.
She's amazing. She's
Simone
amazing.
Biles.
makes us proud every time we see
Every
her
time. All right,
participate.
all right. I'm looking forward to her. If she wants to do it, to be at the Olympics. Okay, let's jump into all things COVID, all things COVID. Any questions that you have, we're going to answer them. 877-955-1061, 877-955-1061. Give us a call, and we'll try and answer them. And I'm not going to answer them, but the doc here, Dr. Campbell, is going to answer them. And I want to thank you once again, Dr. Campbell, for being here to give us the update. You have guided us through this. Well, when did not you know what? It's crazy. Now the world is just cuckoo to me. You know, COVID, the dates, the this, the that. So we got to do the historical thing. So it's been 3 years now, 4 years. I get completely confused since the virus was
Well, it
first.
started probably late 2019, but it wasn't until February into March where 2020, where the whole world was put on its head. And that's when everything got shut down. We went on lockdown because we really didn't understand what was coming at us. You know, we in San Francisco thought, well, this may be coming from Asia, but it turns out that instead of going to Asia, it came through Europe, through Italy, through New York, which got hit hard. And then it came to us. So that the first wave, because we had great public health policies in the city and county of San Francisco, we were able to kind of tamp down the first Delta wave, but then we got hit with Omicron, and now we're continuing to have Omicron surges every so often, which is a fact of life. But we went from having people dying, you know, we were at one point, we had 30, 40, 50,000 people dying every day. We have now 1.2 million people who have died from COVID since it started. 1.2 million people in the United States.
In the United States.
In the United States alone, right? Worldwide is different, but in the United States alone, it's been that. So it still is quite a thing. Now, right now, today, you know, within the last couple of days, there's about 12,000 people in the hospital in the United States with COVID. So it still is a thing that's going on. We have people at our hospital who are admitted, probably not with COVID. They get admitted because they've had trauma, they've had a medical problem, they had a heart attack, a stroke, or maybe they got hit by a car and they tend to have COVID. Now we've transformed it into something that was a killer for all of people who are getting exposed to it if they were immune suppressed or they had other risk factors that are serious. Now it's more something that we can live with now, which is, you know, where we're at now. We've kind of changed it from something that we were all afraid of, we were all separate from each other, to now we've come back. So there's going to be flare-ups around the country, and we have to be prepared to do it. I mean, the reality is that I'm gonna show you something here. Let me just show you this. So this is my trusty mask. So, So I do walk around with it.
Yeah.
And if I feel like I'm in a situation where I may be exposed, you know, like if it's really crowded or something like that, or somebody's coughing, you know, people cough and they wipe their hands and they don't do things, like if you're on a plane or you're going to the airport and somebody's coughing, you know, you want to make sure you protect yourself. So I will still put it on when I have to. And actually, reality is at the hospital, we still actually mask every day. You have to walk in the hospital and wear a mask.
I know when I go to Kaiser, you walk in there, if you're going to get a blood
mask.
test, you gotta have a mask
on. And that's how we are, because we're at risk. And I think last week I was rounding on patients. We had a few people who had COVID in the hospital, and you just gear up, you put on your big N95 mask, you go in there and make sure everybody is protected, and we take care of them like everybody else now, which is before we did the same thing, but we were really frightened because we didn't know how bad it was, how infectious it was. But we understand so much more now than we did before because of science, because of the vaccines, because of what have you. And there's another series of vaccines that are going to come out in September into October, and that's against the new variant that's coming. The new variant is called BA.5. Well, actually, it's called B.286. It's also an EGS5 variant. So this is an Omicron variant there, and the vaccine will be available for that sometime in September and October. Interesting thing is the last bivalent vaccine that was given out last year, you know, this is one that most of us got last year, only 17% of people actually who are eligible got it. And I think
wait. Only 17% of people who are eligible got which? The last dose, the second?
No, this is now, you know, I have had 5 vaccines, right?
Yeah, I've had 4, I think. Because I had two more.
Most people had.
Then I had two more after that.
That's right. And I got the extra one because they were like giving them out. I said, I'll take that one. And if tomorrow somebody walked in, I'll take another one. Right? Because I want to make sure I'm protected because I'm getting exposed all the time. But I think the message has to be is that this is going to be like, now we've converted it from being a lethal thing that people are dying from to something now where it's manageable. We can live with it. You know, everything depends on what your risks are, but you want to make sure you still take care of yourself. And that if you're eligible for a vaccine, you know, if you're over, the next group is over 60. If you've had medical problems, you should ask your doctor about whether or not you're eligible to take the vaccine, because certainly I've actually had a bunch of vaccines and I've had COVID twice myself, but it has been mild because I had the vaccine. If I didn't have the vaccine, then I think it would have been a lot different with doing it.
One of the reasons I want to do this because I want to get correct information out to folks, right? So I got a text from somebody I know very well, and he was like, everyone is advised to wear a mask because he calls it the COVID Omicron XBB variant is different, deadly and not easily, you know, and he went through this thing, no cough, no fever. Anyway, and he put this out like it was his version of gospel, right? And I'm like, you know, everybody was like, what were you talking about? So, you know, and he went double mask doing this. What's going on now? Just so, yeah, I don't know what to say.
So what's going on is what they're doing now. They do they do a lot of interesting things to find out what's going on with COVID. And one of the things they're doing is they actually look in the wastewater. So they go to the water treatment plants, and what they do is they actually track the wastewater to see what variant is present. So right now, all these different names, where it's XBB, BA5, EGS5, whatever you want to call it, these are different Omicron variants. And every so often they will flare up and there'll be an outbreak. I mean, we've had an outbreak at the hospital where some people have been out of work because they got exposed to it and they actually got it. But sometimes it's actually their family gets it and they get it themselves, or they get it in the community, or they get it. So it's still going around. Okay. But what we want to try to do is basically manage our risk, you know, currently right now. So it's not totally going away, but you know, you go and you live things. I mean, you know, this is the first time I've been in the studio, I think, in 4 years.
Yeah.
Right. So it's really amazing being here. So, but you know, we were traveling more, we're going to different places, and you know, you have to manage your risk when you're doing things. So if your doctor says you're eligible for a vaccine, take it. It's like the flu shot now. We just think we transform it to being something that was lethally deadly, that was killing people left and right, where many of us lost family, where African Americans, Latinos, Native Americans were dying at exorbitant rates, 2 or 3 times the rate everywhere else, to something where now it's a smaller group of people being affected, people who are immune suppressed, people who have medical issues, who are now suffering more severe cases. The vaccines allows it to be something where you can be treated as an outpatient. You don't get hospitalized and you don't get sick. You don't get as sick. You may get a cold, but you're not gonna get as sick as you were at the very beginning. Because I had people at the very beginning, friends of mine called me up and said, my wife died of the thing, just dropped dead in the hospital. And that kind of thing is not happening like it was before, because remember the scary days in 2020.
Well, and that's why I was so concerned about, because it set out the alarm, right? And I'm saying, where you getting the information from? And I mean, he actually said he got it from what he was going through at that time. And so I don't know if he diagnosed himself or what, you know, I didn't know. But I mean, look, you know, it was like, man, what is this? So then this is an individual, right? Then you see headlines.
That's right.
That are saying, you know, I'm not sure why Morris Brown instituted the mask mandate again, but they must think something's going on. By the way, I'm sorry, folks. They keep telling me to give out the number, 877-955-1061, 877-955-1061. Any questions you have tonight, we're talking all things COVID, particularly what's going on now, because you may have read a headline somewhere, or you might have got a text like I got that freaked the hell out of me. I mean,
so what it means, so it may
trying to give you the information.
So at Morris Brown, so what may have happened, and this is may have happened in their community at their school. There may have been a outbreak where there were several cases that occurred. So maybe there's 5 cases, maybe there's 10 cases. And what they do is they track it so that, okay, we now have it going around our institution. And when we do that, then people go back and they step back from doing things that they were doing before. And we go back into managing risk by wearing masks, more commonly. I mean, I would tell you, I went on a plane, recently, and yeah, I did wear a mask, and and I'm fine with doing that. Now, I have to say, most everybody was not wearing a mask, but like, if you come up to me and you cough in my face, I got a mask on, right? Right. So that's because I'm trying to protect myself and make sure that, I'm okay and don't make my family sick or make people I work with sick.
You guys can jump in anytime. You got any questions? I know Ann is like, super good. Yeah, like, yeah. I want to ask this because so we got a call. Yeah, let's take a call. Let's take all the calls we can get because people want to know. That's what we're here for. Caller, nope, not yet. Okay, all right. 877-955-1061. And the person who I just talked about, if you want to call, do so because you put out the alarm. So, you talk to the doctor yourself, right? I'm doing this tonight. I'll let y'all know that we're doing this show tonight. 877-955-1061. We got a caller. All right. You're on Street Soldiers with Dr. Campbell, all things COVID. Go right ahead.
All right. How you doing this
Yes.
evening? I had a question about the COVID in regards to all of the studies that have come out about myocarditis and all of these type of blockages that people are getting, blood clots and all that. What does he think about that information getting out? And is that accurate information for the public to have?
So thank you for that question. The first thing is that when you actually get COVID, right, one of the big things that happen is your body forms blood clots, right? You get clots in your intestines, clots in your brain, clots in your heart. You get clots all over. That is part of what we call the pathogenesis of actually getting the disease. So that's part of what happened. That's why people got sick, because they were getting clots and they were killing off their organs and getting problems with that when we didn't have treatment before. And then we were giving them blood thinners and all that stuff. Now, the myocarditis thing is that what happened was there were some reports initially where kids who actually had the actual infection developed myocarditis. This was some reports that came out of New York and other places, but it's actually a small number. The thing that freaked people out a little bit is that there was some speculation by, I think, some anti-vaxxers that if you actually got the vaccine, that you were at risk for myocarditis, and they think that that is not the case right now, right, with that. So the truth is COVID causes blood clots when you actually get the infection. So you can get really sick from it. Number one, myocarditis is not a big issue like it was felt to be at the very beginning of the pandemic. And people say, well, I got this from the vaccine, right? They got autism, they got this, they got that from it. It's absolutely positively incorrect. That does not happen.
Okay.
The vaccine protects you. When I got the vaccine, when I got them, most of the time I just got a sore arm, right? But most of the time, some people may get a fever, they may get some other stuff, but they're very minor, the side effects that you get with the vaccine. So much safer to get the vaccine, not get the infection, than to get the infection and be sick.
Paula, thanks for you. I want to ask you a question. Just run with me. One of the other things I want to ask people: how has life changed for you because of COVID, post-COVID? I mean, I'm really as curious about that as anything else. We had the lockdown and everything, and it doesn't seem like, and the thought might be we're gonna get back to the way it was before, but not really. How has it changed for you?
For me personally, it hasn't changed at all.
Okay.
I did not get the vaccine. I have 2 daughters.
Okay.
One that plays Division I college volleyball over at Cal State Northridge. She got the vaccine. I have another daughter that has 2 girls. She got the vaccine, and my 77-year-old mother, she got 3 of the shots. I chose not to get them because I don't trust the government, and anything they give you for free coming medical, I got questions because they don't give out free cancer meds. They don't give out free insulin. So why are you giving this out for free? Immediately, my antennas are up. So I didn't get it. I did get COVID in the beginning when it very first came out.
Yeah.
Haven't been sick since. So So it hasn't really changed anything for me outside of the discrimination of, gotten to have a mask and a 72-hour, test result, or you can't go certain places. That part kind of.
Yeah.
But other than that, it was fine. Hasn't changed anything for me.
Got it. Okay. I appreciate that. I appreciate your call, man. Thank you. Thank you so much.
Thank you so much for calling in.
Thank you for having me. You guys have a good evening. Be safe.
You
Thank
got
for
it.
calling in.
Absolutely.
Appreciate that.
877-955-1061. All questions, all thing COVID, give us a call, please. Dr. Campbell's with you. We got another one. All right, we want to take as many people as we can. There we go again. Go right ahead. You got to turn down your radio to talk to us. Yep. Oh, we're coming. You're coming. You there? All right. Hello, caller. How are you? You're on Street Soldiers with Dr. Campbell. All things COVID. Go right ahead.
Hello.
Hello.
Oh, yeah, I just wanted to ask Dr. Campbell about why there wasn't a concentrated study on some of these after effects after we give the vaccine to so many people. I know I went in with COVID. They didn't even ask me whether I had it before, whether I had allergies, anything like that. They didn't take any data from me. And I think that's a huge part of them being remiss in the part of taking data to make sure what happens to people before and after. There's no data points. The data points they had was, okay, here's people who had COVID and here's how many had a vaccine. Instead of getting the metadata about each patient, whether they had heart disease before or after, etc. So I'd like him to comment on how
Okay, here
much
it comes.
we missed on getting data.
Got it. Great question. Thank you.
So thank you for that question. The first thing is that you need to figure out who's taking care of you, because if somebody comes in with COVID, the first thing I'm going to do as your doctor, if I was your doctor, is to find out, okay, have you ever had it before? Has anybody in your family had it? What are your symptoms? Do you have long COVID? I mean, what do you have? What in terms of your symptoms? How do you feel now? And we're trying to collect information from you about what your experience has been with COVID, when you had COVID, what it was like, number one. Number two, there has been some studies through the CDC, other institutions, academic institutions around the country, where they looked at long-term effects of the vaccine, long-term effects of having the infection itself. And the things that we're still learning about are things like, okay, well, who's going to get long COVID? A friend of mine got COVID, when I got COVID a few months ago, back in February, and he said it changed his whole life. He was able to run miles. He couldn't run anymore because he actually got the infection, right, with that. So they think that if you have not had the vaccine, that your chances of getting long COVID are greater, meaning that you're going to have problems like fatigue, maybe shortness of breath, some other things with that. But if you have the vaccine and you actually get it, which that can certainly happen, right, that your chances of getting long COVID is a lot less than it was. So the answer to your question is some places have collected data. It sounds like you probably need to sort of interrogate the people taking care of you a little bit more and say, well, why are you not asking me? Because I want to give you this information. Yeah, I had the vaccine. I didn't have the vaccine. I had the vaccine. This is what happened. I feel okay now. And I mean, that's the first thing, as soon as I hear somebody had COVID, I said, okay, well, how bad was it? Were you hospitalized? Did you get intubated? Did you go to the hospital? I want this information because it allows me as your physician to take better care of you. And that's what the goal is, to get the best care to you possible as a patient where you're going. And I don't know where you go to get your care, but certainly you need to make sure that you demand that they ask the questions that you want to have answered, because you need to make sure you make them do their job.
Go ahead, caller. You want to say
Go
something?
ahead. Sorry. Go ahead.
I just was going to say, it seems not just anecdotally. Many people I've talked to, they don't take information about pre-existing conditions and gather that up as a larger study. I think it was a huge missed opportunity to see what this virus did and what it did not.
Yeah. Good. Let me ask you the same question I asked the caller before. How has life changed for you after the lockdown? After I want to say post-COVID because it's still here, but has life changed for you in any drastic way? I've heard people, things like the work,
I think
everything
I
at work
think
has
the
changed, right?
observation.
Go right ahead.
Yeah. No, the observation I have is what has happened was they accelerated the economy like 10, 15 years.
Mm.
They went into the gig economy and had so much developed that would have took 10, 15 years. And now everybody's, certain businesses have taken advantage, and that's very, very good because for those businesses, they now can order things online. For example, on Amazon Prime, they were happy. Not happy because of COVID.
I'm sure live at your house too.
Drop their name, but the economy has accelerated, but I think it is not coming back. You see San Francisco, you see the deplorable conditions in different cities just getting worse, and people are more removed now. That's my observation.
Thank you, man. Thank you for your call. Really appreciate it.
Thank you.
Thank you for your question.
Thank you for having the show.
877-955-1061. You got a question about COVID, please call. Want to answer as many as we can. We have another caller. Let's do it. Hi, you're on Street Soldier.
Hey, Mr. Marshall. Hey, doctor. I was just calling to ask about what would you suggest in terms of a parent talking to a young person about the vaccine? How do we encourage them, or how do we inform them so that they can make the best decision for their future in terms of the vaccine? So I'm a mom. I allow my children to make the decision for themselves medically. I definitely try to give them the resources and the information that they need to make the right choices. But, I'm concerned. I've heard about the side effects. I've heard about different things that happen in terms of the vaccine. So what would you say in terms of suggestions and how to navigate that process?
Well, thank you for your question. So can I ask how old your children are? Are they young adults, kids, or how old are your kids?
I have a 26-year-old, I have a 10-year-old, and I have a 2-year-old who obviously doesn't have any option at all.
Yeah.
But
Yeah. So
the 10-year-old and the 26-year-old, for sure, we definitely have the conversation. The 26-year-old is vaccinated, the 10-year-old is not. We have left that decision up to her, but I wanted to just, pick your brain and see.
how old is she? She's 2, or she's how old? 2?
Yeah, I think you said
She's 10.
10. Okay, 10 years.
Yeah.
All right, so she's actively going to school. So let me just say the first thing is that I think the statement that the side effects are big, or is really overblown. The side effects are not that significant given large numbers of people who have gotten the vaccine. So number one. Number two, when they're younger, you have a little bit more control over what you need to do. Because the thing you got to worry about is when you send them to school, because I assume she's in school, whether or not you want to make sure your kid is protected as much as possible. Because some of the classes, as you probably know, they're kind of like petri dishes. Because one kid gets sick, another gets sick, another gets sick, and you want to make sure that your kid is protected as possible. The adults, they can make the decision for themselves and with that, but the ones who are of school age, what you do first of all is you talk to your doctor, your pediatrician about your kid, and then sort of say, all right, well, is this something we should do? In general, the pediatricians have been recommending that as part of the vaccination series that the kids get, whether or not measles, mumps, chicken pox, all that stuff, that they get vaccinated for COVID in the midst of that series of things too, because it just makes sense to try to protect them as best as you can when they're going to school, because you don't know when they're going to get sick. If they get sick, you want to make sure that they're protected as much as you can. But it is a difficult problem for parents who, well, what's best for your kid when you're trying to make a decision, particularly with all the the misinformation that's out there regarding vaccination. So let me just sort of do it. Vaccination is safe, right? If you choose to do it, there is not really major side effects, and your kid will be fine if they get vaccinated. And that's what the pediatricians tell me, and that's what I tell my patients, no matter how old they are.
I hear you say that the vaccination is safe, but it just seems like it came out so quickly. And how can I trust that it was safe? Just even for my children or myself, being that it came out so quickly. Like, did they have this on reserve, or like, was it tested? How can I trust it?
So that's a good question. I'm always suspicious of things that come out fast too, because you're like, oh man, they just had a little bit of this in the closet and they're going to sneak that in on you, right? You don't have something that they have. Let me just put that. Yeah. So you don't want to have that. So what happens is they have been actually expecting that there was going to be something like this for a little while, because you probably remember we had H1N1 and this flu, they had the swine flu. I mean, there's just a lot of different, this is SARS-CoV-2. So that's what the official name of the COVID infection is. So that means it was a SARS-CoV-1. So that means that they expected that something would happen and that people would get sick from this, from this infection. So they started actually working on it probably several years before. And it wasn't until probably 2019 when things actually happened, where things got really accelerated and they started working, whether or not they were doing stuff with Pfizer or Moderna or Johnson & Johnson actually had a vaccine, and there's others that had vaccinations also that they started rolling them out. In the very beginning, there was there wasn't as much experience, but now they've given, I think in the United States, we've been 150 million vaccinations, right? 150 million.
Wow.
Right. So if you got 150 million people, right, who got vaccinated, that would mean that there would be masses of people who would be having side effects. And I don't think we have seen that. And I certainly have not heard of that
yet, but
I have not heard of it. But it's always important to be skeptical, especially when it comes to your kids. But there was some information done before. One of the scientists was an African-American woman who actually helped develop the vaccine at NIH with Anthony Fauci. So she was there. She helped develop it. Dr. Kizzy, I've forgotten Kizzy's last name, but she was right there in the middle of it. And they had put things together. And what they did is they gave incentives to the company, incentives to the National Institutes of Health to accelerate the process, because it was such a pressure to make sure that we move forward and we offer something to people, because people were just dying in large amounts. I mean, this is what drove that whole process.
My mother fell ill in 2019, towards the end of 2019, October, November, December, and we were in ICU for quite some time. And I remember the nurse that was caring for her. My mom became very paranoid, because she was like, I hear the nurses talking about I'm dying. But it was the nurses saying that, they were just scrambling because people were coming in from a cough and they were dying, and the nurses were very confused. And I remember pulling a woman to the side and asking, like, my mom is freaking out. What's happening? And she just was very scared. So I do remember when the process started happening in 2019, towards the later end of it.
It was really scary because we didn't know why people were coming in and just dying. Think about this: 30,000 people died in New York City. I mean, 30,000. Now, that's a lot of people.
Yeah, no, it was real.
It was really scary.
And we were in there for a gallbladder. My mom had a botched gallbladder surgery. And so the people around us that were coming in the ICU, they were dying from just a simple cough. That's how the nurses described it. And my mom was very paranoid, because she was like, are they talking about me dying?
Yeah, it's kind of scary.
And it was them. Yeah. So
it's quite scary. Yep.
I want to ask you, because you have a 26-year-old and 10-year-old, but one of the big issues, of course, during that time was that the kids couldn't go to school, right? And how were you able to deal with the education piece? Do you feel your kids suffer?
I'm not a teacher.
I know.
Like, I never signed up to be a teacher.
What I mean, but did
I play one on TV, right? I got
you. They had to go on Zoom, and they had to, they couldn't.
I mean, my children Well, my 10-year-old for sure, she definitely suffered
Yeah.
in terms of like academic,
Oh, yeah, it's a
Yeah.
big thing.
socially, like she's already struggling with some social stuff. So like
Yeah.
it was a setback for sure. And just in terms of as a young person, I feel like it definitely stagnated their growth.
Yeah.
Like so what we think might be a 10-year-old because of COVID, you gotta take that year out. You know what I'm saying? Like
Or a
some
couple of
people
years.
don't
Yeah.
It's a big,
right.
it's a big
And so
factor.
some people don't really see it as that.
Yeah.
That's
yeah.
a real problem.
Yeah.
You,
Yeah.
you know, it's like when we're young, we're ripped of our childhood and then we try to make up for it when we're older.
Right. Right.
COVID really did a number on these kids as
Yeah.
well as parents. I mean, my
Yeah.
business definitely suffered. Like as a small business owner and a single mother, I had to shut my business down, like both
Uh-huh.
of them. And I haven't been able to recover since. It's
Yeah.
just been hard.
It's hard.
And with the passing of my mom, it was not COVID related, but still like being able to balance all of these systems during that crisis, it was very hard, regardless to them trying to put certain economic things in place. It was still very hard. And coming out of it, even though it's been 3 years, I feel like we've been out of it for like almost 2.5 years. I feel like it's still been a struggle.
Yeah.
Like socially, trying to
Yeah.
get back on balance,
Right.
defining that structure and that discipline and routine. It's
Right.
just been really hard.
Thank you. Thank you.
Thank you.
I really appreciate your call and your comments, and stay safe. That's what we can say. That's what we can say. All right, we can take one more. We can get one more. 877-955-1061. 877-955-1061. We got a few more minutes before we take a break. Move to hour number 2. Okay, I want to ask you a question. All things COVID, once again, 877-955-1061. Doc, I want to know, when I see people wearing a mask outside, I get confused. I really do. And I'm trying, I mean, inside I got it, right? Right. Well, he can explain it to me. Okay. So what's going on when people, what do they think? I mean, they're outside in fresh air, no, and nobody's around. So are they just being overly,
Or in their car.
That's,
Like,
now
wear
that's
the
the one
mask.
that gets me.
Yeah.
Nobody in the
Yeah.
car. Nobody in the car but them.
recommendation for that?
So when you're, no, so you don't have to do it when you're outside unless there's like thousands of people around.
Yeah,
and
you're
it's
at a
big
concert,
thing, you're at a
yeah,
concert if
yeah.
you want to do that. But in general, if you're outside, it's fairly safe to do it. The issues become when you're in a space where there's thousands of people and it's closed off and those kind of, and ventilation is not the same. That's
Yeah.
that's where
Well,
you have to
yes.
be concerned. But yeah, outside in general, you could do what you want to do outside.
What about in your car? Just
Yeah.
you.
By yourself.
By yourself, you don't need to wear it. You don't. Need to wear it,
I
but-
don't want to use the word paranoid because it's a disease, right? I mean, I get it. You know, you really don't, you want to be not overly cautious.
That's
That's
right.
good. But you know, it's always confused me. I'm just like,
Yeah, outside, fine. You know, if you're not in a confined space,
We
it's
got-
okay.
yeah.
Sorry, doctor.
What?
Dr. Campbell, right?
That's right.
Yes, sir. We got one caller. We're gonna take this one call. We
Okay.
got about 2 minutes left.
Yep, and we'll take a break.
Exactly.
All right, yes.
Yeah.
All right, caller, you're on Street Soldiers with Dr. Campbell, all things COVID. Go right ahead.
Turn down your music.
Hey, I'm just calling out. I'm listening to your cast and you guys what you're talking about, and I just heard a young lady speaking, and I wanted to just chime in and say I feel that during COVID, it really affected people, like as far as their families and the husband, the wives, the families, all emotionally. It affected us, you know, in a way because we were like in the home together 24/7, working from home.
Yeah,
And it either brought you closer together or it
it rip you apart.
created a breaking point.
Yeah,
That's
And
correct.
for many people, including myself, it was a breaking point. Like you really need to be in tune with your spouse or your mate, because I feel like I personally actually read that divorce rates went up
yeah.
due to COVID, because you have to really
and
like the person.
domestic violence.
Domestic violence, big
Domestic
time.
Wow.
That's right.
Big
I
time.
agree with
Sure
you.
did.
I
Yeah.
agree with you.
Yeah.
Yes, that is a fact.
That's
Yeah,
true.
I agree with you.
That's true.
And you know, I love my husband, but we had to take a break. We had to like say, hey, you go to your corner, I'm gonna go to my corner, and we're gonna come back together, because it was very, you know, when you're getting up going to work every day and you leave that house
Yeah.
and then you come back home, that's one thing. But when you're in the home 24/7. And then we had a child in high school. He it even affected him psychologically.
Wow.
He said he came to me, he said, Mom, this sucks. Because he plays sports 365 days a year, track, basketball, football, everything, all that stopped. And he was like, I said, just come out and walk with me on my lunch break, son. And I had to get him some counseling because it was really, and he was okay, but it was like depressing.
Thank you.
It's a huge thing. I agree
It was
with you.
depressing.
Thank you so
That's
much for
very
the
good.
call.
That's true.
Live and free radio, Street Soldiers. Check us out on Zoom. I'm sorry, on Facebook, facebook.com/stay alive and free. And on the iHeart app, we're continuing our discussion around all things COVID. We have the wonderful, that's it, the wonderful Dr. Andre Campbell, professor of surgery at Zuckerberg San Francisco General Hospital, answering all your questions, giving all of us the latest information about COVID. And he's been a very busy man. He's been all over the place, and we're going to hear a little bit more about that later. If you want to give us a call and talk to Dr. Campbell, the number is 877-955-1061. You can call into the studio. We'll put you on, and we'll do our best to answer your questions, answer all of your questions. Joining us this hour, first, we have Erika Lazo. Is that correct? I say that right, Erika? Can you hear me?
You sure did, Dr.
Right.
Marshall.
And I want to thank Ann Bissett for you had some interesting experiences during COVID, and you actually began to write about them. So I thought your story was wonderful, and I thought it'd be great to share it and you get your perspective on all of this. So Erika, the airwaves are yours. Go right ahead. Thank you.
Thank you, Dr. Marshall, Dr. Campbell. It's an honor to be here with all of you this evening. Thank you for giving me this opportunity. I began my writing journey a year into the COVID-19 pandemic. It was the year 2021. And my mother had been diagnosed with stage 4 ovarian cancer. And I was also very recently postpartum. My second daughter was 10 months at that point. And so I was going through a lot emotionally, hormonally, and I just had all these mixed feelings that came about with, dealing with my own motherhood journey, raising my now 5-year-old daughter, but at that point, 3-year-old and 10-month-old, and also grappling with the fact that on the other end, I have my mother that is ill with this possibly terminal cancer. And so at that point, I thought, okay, we're in lockdown. We're basically, sheltering and, isolating. And it wasn't like, oh, let me go have happy hour with a friend. It was very lonely time, right? Because we were all just at home, and something told me just start writing. And during the writing process, it became something very therapeutic for me to do, to basically start from the beginning. So the title of my book is My COVID Diary, Reflections of Childhood, Parenthood, and Loss During COVID. And it originally wasn't meant to be published. It was something that, like I mentioned, was self-therapy for myself, something to kind of like help me make sense of all the chaos that was happening around me and also collectively. And as I began to write, I couldn't stop, and it ended up turning into a body of work of a total of 9 chapters, in which I begin from the beginning. So my childhood, and then growing up, what it meant to be a child of immigrants. My mother migrated here from El Salvador. And so just kind of like reconciling our relationship, her form of how she was raised, and then how that formed her way of raising me. And then now raising my children, fast forward to now COVID, where it's like, everything, if there was fear, if there was underlying already internal situations, like the caller that just spoke last said, like if you're having complicated relationships, it feels like everything just was brought to a head. And so writing just helped me make sense during a time where it was very complicated. And my hope is that sharing it with the world, sharing my writings, it will help others feel not so alone with their own internal struggles, because it seemed like, and it didn't only seem, it was, right? COVID was very isolating and it was a very lonely time. And so I thought, I remember one time vividly, I'm washing the dishes and I look outside the window and I'm like, it can't be, I'm not the only one going through this hardship right now. Like there has to be someone, millions of people right now that are going through the exact same thing that I am. It's just that, we're not communicating, we're not connecting right now as a society. And so I thought to myself, someone's going to write about this. And then lo and behold, I took it upon myself to write, and that's how it came to be.
That was I love the word therapeutic for you. I mean, you did it for you, and it ended up being something that everyone can relate to, because everyone has their COVID story, right? Everyone has their COVID story, and either we talk to each other about it, or some of us didn't talk about it at all. Or we suffered in silence. The interesting thing is that, as when I was talking to you, about what we're going to do today, is that you didn't actually get COVID until later on.
Yeah, I got COVID with the last Omicron wave that seemed like took everybody in its path that hadn't gotten COVID at that point, which was last year, like springtime. I don't know if you remember, but it seemed like if you hadn't gotten COVID by that point, at that point, Omicron was coming for you. And so we had to be very protective over my mom, who at that point was going through chemo, like I had mentioned to you previously, and she was very immunocompromised. And so we did have to protect her. And, we were very scared. There was a lot of unknowns, and we asked her oncologist, is it safe for her to get vaccinated? And the doctor said, yes, like yesterday, immediately vaccinate your mother. And so we did, and we took all precautions so that she would remain safe. And I'm happy to announce that she is in remission currently, and she was able to beat ovarian stage 4 cancer. But I also write.
Congratulations.
And so I also touch upon that, because ovarian cancer is one of the silent killers for women. If we don't get checked, if we don't, it's the symptoms are so subtle that it's not until the cancer has spread where you begin having symptoms.
Can I ask a question?
Yeah.
I don't know if this has been asked, but for some people that are ignorant or young, or like, COVID affected millions of people, but for some people, we were ignorant to like everything that happened because of COVID, whether it be wearing a mask. How do you my question is, how do you deal with the people that don't that are young, or just, they just doing their life, and they to me, it almost became annoying in a selfish way. You know what I'm saying? It's man, why I gotta do this? I almost got sick of it.
So let me tell you. So as a physician and doctor,
yes, sir.
We're always trying to make sure we keep people healthy. And I had young people who I saved their life, and they're 30. They have kids, who are young, and they're like, "Well, I'm not vaccinated," and they just basically said, "I don't think it's necessary. I don't think I need to do it." And and I'm just and you try to sit there and you try to talk to them, and there's some people that you can't get through to.
Got you.
And that to me is something that's very frustrating, because I mean I see people die. I see people die all the time, and it to put yourself in that situation, or your family, your kids in that situation, to me is a lot of ways not the best way to do things.
Okay.
And yeah, maybe selfish, and I think it's wrong, but you try to make sure that, you understand, like, do you understand this? You don't understand why you need to have it, and you try to educate them as much as you can.
Real quick, Dr. Campbell, the Spanish flu happened in 1920,
1918, yeah.
1918.
Yeah, over 100 years ago.
And they used masks and they did the same things.
That's right. They
Okay,
did.
got you.
They did the same thing. So they had no technology.
Right.
You see, we had this thing where there was a vaccine on the back burner, and within a year, 6 months to a year, we had the thing up and ready and out, to people. So we were fortunate back then. What it did is put people in isolation. They put them on a mask.
Okay, got you.
And that's it. But there were a lot of
But
people died.
they did the methods though.
Oh yeah.
So people
yeah.
be like,
But there were people who were anti-mask back then.
Mm-hmm.
The same thing. They're like, well, I don't need a mask, and there's like books about it. And I mean, all the things we went through now, it was totally repeated 100 years later, except now we got more technology and
To
we
help
actually could
us.
identify it.
Right.
I mean, 100 years ago, they didn't know what a virus was, right? They
Gotcha.
barely knew what bacteria was. We didn't have antibiotics. We didn't have antivirals. So antibiotics treat bacteria and antivirals treat the virus, right?
Gotcha.
The vaccines treat the virus.
Yes, sir.
So there are different types of infections.
Interesting.
Erika, how's life for you? First of all, tell us the title of the book. I didn't get it. I want to write it down. Tell us the title of the book now, journal now, a book.
Yes, Dr. Marshall. The title of the book is My COVID Diary, Reflections of Childhood, Parenthood, and Loss During COVID. And it can be found on Amazon. You can also go to empowerhealovercome.com, which is the website I created for the book, and you can read more about the book and myself. But for purchase, you can go on Amazon, or you can go to Empower Heal Overcome. That's my handle on Instagram also, and you can find the link there to be able to get your own copy. And so yeah.
Have you had any reactions? People read it and come back to you and said, have you had any of that?
I have. I've been really blessed that I've had very positive reactions so far. Particularly family members that I was a little nervous because I was very open and very I didn't hold back when I wrote. I hear that from people that have read it already, that it seemed like they were just talking to me, which is something that's really positive, and that's how they were able to read through all 303 pages so quickly. I was really impressed that the people who have told me they finished the book, that they've read it so quickly. I'm like, oh, that's a good sign. I'm glad, because it does, in 9 chapters, it encompasses a lot. And I talk about a lot of things, motherhood in particularly, being a mother of a 5-year-old and a 3-year-old and having my hands full, and the dynamics of, what it means to be a mother right now, currently. And I also talk about the dynamics of the relationship with my mother, and, going into the topic of ovarian cancer and just how COVID affected everything, and it's hard to believe that it's only been 3 years. And I can imagine that in 20 years, this will be a far distant memory. And I wrote it also as a testament for my daughters to have, and for them to be able to look back and, oh, really, Mom, this happened? Wow, because it's part of our history and it's made an impact in all our lives.
Oh, absolutely.
Big time.
I think it's literally the world is, I don't want to quote a TV show, a different world, but it is a different world. I mean, it's a different world after COVID. And I see little vestiges of that everywhere,
Yeah, absolutely. It seems like it brought everything, people's fears, everything that was already, so frail in America right now, with racism. It just, everything came to a head, and so we need to heal. We need to, part of the reason why I wrote too is to inspire others to find ways to find an outlet for the pain that we're in, all the anger, all the loss that we've experienced, and the grieving process.
Well, and that, a lot of our loved ones who passed, we couldn't have funerals. We had,
couldn't have it.
we couldn't send them off properly, so there's a lot of hanging over.
Yeah, absolutely. Absolutely. That's exactly what it feels like a hangover of all these emotions that we haven't dealt with exactly, so in our own way, we can be try to be conscious as we can so that we can, heal ourselves in a way. I found that writing was therapeutic for me, but perhaps, for others, it can be in other aspects of their lives that they enjoy through art, music, etc., whatever, because I know that therapy can be taboo. But if you need to talk to somebody, absolutely. Like as much healing as I found with writing, I'm talking to somebody, and that can hold a little bit of stigma or taboo, but no, absolutely. It's okay to talk to somebody, just the same way that it's okay if you have to go to the orthopedic because, you fractured your ankle.
That's right.
Missy, you want to say something?
No,
Erika?
I think it's just wonderful that you found that way, that process that can help you process and work through your journey, the pain of it, and then find some healing.
Thank you. Yeah. In the end,
In fact,
that's
not
what it's all
only
about.
but for others.
Yeah,
And so that's
absolutely.
We got a
Yeah.
call, I think, 877. Yep, we got them. Don't have them. Oh, all right, got a call. You're on live and free Street Soldiers Radio with Dr. Campbell, all things COVID. Yes, no, can we hear you? Nope, but you're not saying anything.
They're not saying it.
You're not saying anything. They're just listening, but they're not talking. Okay.
Oh, there you go.
Hello?
Yes, you are on. Go right ahead. Thank you.
Can you play some NLE Chopper?
Man, this
That's not
ain't
for
the
us.
time for that.
Yeah,
This
that's not
is
what we're
Street
doing.
Soldiers. We haven't had that in a while. We used to get that back in the day a lot. We get it big- That made me laugh. That took me back. Oh, Erika, thank you so much. And it sounds like wonderful. How's the family now? And are your COVID issues settled, or not the issues, but your own health good? Around.
Yeah. Thankfully, yes, I'm good. And so is my mother. Like I mentioned, she's in remission currently from stage 4 ovarian cancer. And I really thought that was a close one. I really thought when we got that diagnosis that was it. Like I started, I know this sounds really morbid, but I started mentally preparing of, what was to come. Because when you hear the C word, you associate it with, okay, it's terminal, it's it. But I believe in miracles.
Well, your own cancer. I'm sorry, your own COVID issue. Was it bad for you? How was it? How was that?
So luckily, when we ended up getting COVID, the Omicron strain in 2022, this was last year. Coincidentally, it was during the week of my 40th birthday, and we had planned a trip, our first family trip in 2 years. I thought finally we're going to be able to do something, and boy, did COVID have other plans for us. I inadvertently ended up giving my family COVID, and I laugh, but COVID does not discriminate. It's nobody's fault. And, at that point we had been in our bubbles and we had been so careful. And it just goes to show you when it's COVID, when COVID comes, we took all precautions, but thankfully it was a strain that didn't make anyone severely ill. And my little ones, kids are so resilient. That's something that I was very, very grateful for, despite the immense loss that so many of us had with, our older generations, family, but the kids, the way that they just were almost unscathed, right? My little ones, when they got it, they just had a fever overnight and that was it. And just the cough. It seems like COVID hit adults a lot harder.
Yeah.
And thankfully the younger generation was spared for the most part. So as a mother, that gave me a little bit of relief that I knew that my little ones were going to be okay, particularly being pregnant during the pandemic and feeling so fearful of like, okay, what if I get the injection and it affects the baby somehow, all those things. And thankfully, 3 years later, and I'm grateful that on my end, everyone is okay and healthy. And I'm also cognizant of the thousands that are mourning and grieving. I have extended family that lost close family members. And
Dr. Campbell wants to reply. That about being just say that because
What's that?
yeah,
She was wise to get the
wise to get the injection.
Yeah, so
Maybe
when
it-
even when you're pregnant, it's wise to get the vaccine. So it's very common for the infection to be spread among family members. So you get it, your kid gets it, your husband gets it, your partner gets it. That's a
right.
that's a pretty even when you're careful, you could do that. So you have to really you have to go out of your way to isolate at home to make sure you don't give it to your significant others, your kids, and what have. But even if you do that, if you have a small child, you can't isolate from them, right? So that's the thing. So if they're going to get it, you're going to get it.
Yeah, that was the challenging part, particularly. It's like, okay, I'm currently breastfeeding. Like last year, it was like, it's almost impossible. How can I quarantine from like my baby who is dependent on me for survival?
You're gonna get it, and you just ride through it. And it's usually older folks older than 65. People with multiple comorbidities. Those are the folks who are really affected. By the younger people, they would get it, but not as severe. But certainly, young people did die from it when we first had the big wave that came with Delta.
Right.
First would hit. We got hit more in California with Omicron, the second wave in the 2022 and 2023. I mean, that and there's sort of little spikes as it goes up. But it's thank you for sharing that powerful story, and congratulations on your book.
Thanks a lot.
That's amazing.
Thank you so much.
Thank you so much for having me.
Thank you. It means a lot to me. And thank you for giving me this platform and forum to share my story, which is my goal, just to story share.
We're so proud of you. So thank you so much for sharing your story.
Thank you. I'm happy to, because if it inspires others to find outlets that will help them through whatever they're going through, that's my goal through story sharing.
Congratulations.
Thank you. Thank you. Thank you. Good night. Thank you.
Thank you. Good night.
Bye now.
I want to ask about, we talked about California, talked about America, COVID in the world. How bad did it get as you could, talk about?
So we had it bad here, but they had it bad in Brazil, India, through Europe. I mean, think about what happened in Italy. I mean, it started in as it sort of came through. It started in China, and then sort of everybody thought it was going to come this way, but it went through Europe, and Italy had tremendous problems where people were just dying all over the place. So it was a worldwide phenomenon. There were, Europe, South America, the Far East, Australia. Australia did something interesting, and New Zealand. They went on severe lockdown, and it was really
New Zealand. I remember they ain't playing with this.
They were really like it was really we thought we had it bad with lockdowns there, but they had to have paperwork to go through barricades from the police. I mean, it was really a police state down there, but they were able to kind of contain it initially. It wasn't until Omicron came around that they actually started having problems with it, like everybody else did, right? Because they were able to, because they're essentially an island, they're isolated, they can actually control their borders, who comes in and that kind of thing. But it's pretty much a worldwide problem.
How cooperative was? My first thought is the developed countries, those that had the vaccine. How cooperative were they in getting vaccines to other nations? I know there was a clamor for that, but I don't know how that actually worked out.
I think at the beginning, when we didn't understand, we were probably not as good about sharing. But I think once we were able to get the vaccine out to people, and there wasn't the whole thing is there was such pressure on the healthcare system at the very beginning. We needed to kind of keep the vaccines here. But I think as the pressure on the healthcare system reduced. We were sharing it, and I know that certainly our current president did what he could to actually share it with the rest of the world.
Yeah.
Now, our previous president did not do
But
that.
we don't mention that guy's name unless we go into court. Okay.
And an orange too for me.
You do? Yeah, sure.
Stefan wants to know, did we get too comfortable too fast? And where
great
should we
question.
wear masks?
Yeah.
That's a good question. So, do we get too comfortable too fast in San Francisco? I don't think so, because we were. I mean, we still, in some ways. I mean, one of the reasons why we're having some trouble downtown is that only 35% of people come back to work. I mean, there's a 40% occupancy, so there are people. I mean, there's a lot of people who are working from home and that kind of thing, which has caused which has caused some issues, certainly financially, with the city. But I don't, I think we've been cautious in coming out of it. We waited until people got. The whole idea was to get as many people vaccinated as possible. So that's one way to do it. People did get the infection, have some immunity with that, and some people had both. They had the infection and they got the vaccine. So immunity is kind of spread through that. And I don't think we have come out too fast, but I think you just have to realize, if you're at a job and all of a sudden people start getting sick with COVID, wear your mask, take care of yourself, do what you have to do. But, you should always be washing your hands anyway when you're dealing with stuff.
Okay.
Do you have to, would you say it's mandatory to wash your back? I'm joking. I'm
You
joking.
had to get that in.
I guess you're like a dirty back.
My goodness.
Yes, so you wash your dirty. You need a long brush for that.
That's my little saying. I'll be saying wash your back.
That's his thing. So,
Sorry.
yeah,
I'm joking. Do you do
it? Let me ask about, let me say, Africa. What data do we have on how obviously Africa's a large continent, right?
But the 56 countries or more.
56 countries or more.
There's a lot.
But can you comment on how it affected Africa and where are they now? Any thoughts about that?
Well, I think at the beginning it affected them like everybody else. But I think as time went on, I think they were probably better with controlling things. But I don't have any hard data on instance. I know what happened in Europe, South America, India, and the United States, but I'm not sure if they were as good as they could have been with collecting information. I'm talking about the World Health Organization was very good about collecting stuff in Europe, United States, South America, Asia, everywhere else, but I'm not 100% sure if they were collecting as much data as they should have been regarding. I mean, Africa's a gigantic continent and there's many, many different countries.
And I'm not surprised that Africa came up last on the list, right? That's just
as far as the COVID.
Well, no, data collection.
Okay.
I did.
Well, Africa's a continent, though.
Well, Europe's a continent too. Asia's a continent.
But
yeah,
we
okay,
gotcha.
Order,
I'm just saying, like when you think of Africa, sometimes you think it as a country.
Oh no,
but it's like you said, it's 50 countries in Africa.
That's right.
It's not 50 countries in Europe. It's like
no
Italy, Spain, where else? France.
He's showing you know.
That's just running down the country.
Argentina.
You gotta back out with Czechoslovakia, right? Right. Serbia, Croatia.
Right. Ukraine. Yeah.
I got you. Right. Ukraine. Right.
This has been pretty thorough. You have any lady anything you want to ask in particular, and you want to ask anything that we didn't have to have a chance to cover? Because and then he'll of course there's some other things he's doing, but he'll give the best advice as of like August 28th, 27th. Was this 28th today, right?
Yeah, that's right.
Hey,
27th,
right? 2023. But go ahead. And you want to ask something?
No, I mean, I think you touched on it a little earlier where the parent was asking about the children. And I think for my daughter, who was 5, when it was going on, she couldn't get the COVID vaccine and had to go into TK. So I was very nervous, at that time with it. But she had already had it before and was sick. but got over it. And
Yep.
so when she went into the school, I guess I just wasn't as nervous because they're all getting sick and it's like cold or COVID or I don't know, but I feel like you're gonna say yes to getting the vaccine for her for the
Yeah, I think
5-year-old.
what
Yes.
I would. Well, first of all, you have to talk to your pediatrician, right?
Yes, they already said do it. Yeah,
Yeah,
if you
yeah,
want to do it, you can.
that's-
The flu vaccine is also coming out next
right,
week,
that's
so
right. So you just take what they recommend and you do it because you think about it, the kids of that age, they're all kind of petri dishes and they're all sharing, saliva, everything else with each other. They're hugging each other, they're doing all that stuff in there. And they'll come in, they have a sniffle, they're like, oh, they're febrile, they got to stay home, so so you want to try to protect them as much as you can. So.
thank you. Because I was a little nervous.
It's normal
Because
to be
she
nervous,
kind
yeah.
of, like I felt like we got through it in a way, but we also didn't get through it, and so it was like, what's the best thing to do for her?
That's right.
But I trust you, so I feel.
I'm glad somebody trusts me.
Hey, when you told me it was good, I'm good. It's like, look, I trusted you. I trusted Barack and Michelle. When they got it, I'm good. That's all I need to see. Look, they went on TV and I'm gonna get it.
That's right.
I know older adults were more susceptible
That's right. Yep.
because I hear the word. It's fun. You hear these words, comorbidities. You don't really understand them, but it's something going on, right? But young people weren't, and aside from the fact they didn't have those comorbidities, what made them not as susceptible to the virus?
Well, comorbidity, just when we say comorbidities, what it means is like, do you have high blood pressure? Do you have diabetes? Do you
Okay.
have heart failure?
Okay.
Do you have kidney disease? Do you have liver disease? Those are the things that, do you have, issues related to your blood? Do you have anemia? So those are the comorbidities that we talk about. And as you get older, those things kind of add up. The
And young
younger
people didn't have them, right?
they don't have it. They got more, you're older, you got more mileage, you got more, things going on. And those are things that made it more difficult in terms of the
Banner's nodding her head.
That's-
Even though she's being really quiet,
Yeah.
she has the comorbidities.
Yeah.
That word sounds funny.
It's pretty good.
But
It's
and
pretty-
she had COVID.
Yeah, then
Yes,
also,
but you need to talk.
your weight, whether
Yeah.
or not, are you overweight or not. So those are the things that, whereas the kids don't have as much as that.
Yeah.
Right.
Yeah. I don't think that was on. Okay.
I worked in the clinic and the thing that I noticed so much is how COVID affected the staff,
Mm,
the nurses,
yes.
the
The
doctors.
healthcare worker.
They were
Absolutely.
devastated and they were tired,
Yeah.
and no one acknowledged and noticed them until the end. Because of that, so many nurses have no longer work in a
Work.
hospital
Yeah.
setting.
That's
So many doctors retired and started private practice. So many chaplains backed out and quit going in because we had to work those long hours.
yes.
And then watching people die and watching the nurses and the doctors, and they would call in the chaplains and I would go stand at the door. I would not go in because of my own personal health.
Mm-hmm.
But I've never seen so many staff grieve about not being able to provide the care that the patients needed. And then I myself personally had to deal with the families, and there was nothing I could do but just hold their hands. And so the staff, hospital staff, will never be the same either.
Right.
Because the
Yeah.
nurses have resigned and retired.
Yeah.
And when they started dying and we started losing nurses and doctors start dying, people said, I'm done.
Yeah. The impact on the profession itself.
So I think, thanks for making that point, because that's a big one. There's if you look at think about this, so when you're really saying what really happened. So people were dying. Their families couldn't come to be with them. The nurses would have to turn on FaceTime and they would actually then watch someone die. And there were times in New York where there would be 10, 15, 20 people dying a day. So what happened was people were experiencing death in numbers that they had never experienced before. So as a result of that, people, doctors, because we're people to nurses, people to chaplains, they develop post-traumatic stress from that whole situation. And they talk about the second victim, and the medical providers were the second victim with all that. And what being a second victim means that you have to process all the stuff you're seeing.
Yeah.
I mean, they were seeing death in huge amounts. Imagine if they're like the code goes off 10, 15, 20 times a day, and everybody just, you go in there, do what you have to do, and they all die. And that just has a tremendous effect on your psyche. And that's why nurses, doctors, have left the profession because they, respiratory therapists, x-ray technicians, everybody who has worked in a hospital, some of them have actually left because they're like, I've had enough of that and I'm done.
And
I'm hearing this right now, and I'm just,
Because we had to stay in there.
man,
Oh, it's a real thing.
that's
Oh, it's a real thing.
It's very, like, people talk about COVID deaths, and it's almost like it's whatever, but it's like when you bring it on that scale, it's crazy.
It was a terrible thing.
It's
I mean,
terrible to witness that 15, 16, how many times a day that.
And
I'm going through it right now, just y'all talking about it.
Yeah.
So I already know that the nurses going through it
Right.
was a lot.
It was a lot.
God bless all of those frontline care workers during that time. It's just, they were incredible.
Man,
Just they were,
they were real heroes.
We know a couple, who we of our young people who are doing that, and they were heroes. Absolutely heroic. And those, and then it was the unknown, right? It was like, so yeah. Thank you. I'm glad.
Thanks for
And
sharing
the
that.
worst part when the
Let me,
family
your
members-
mic, jump on the mic, honey.
I don't want to repeat myself, but the
No.
part that was most traumatic is when the families would come
Yeah.
and we couldn't let them come to see their
Oh my God.
family members.
That's right.
And
Yeah,
so
that's true.
the chaplains would have to go and sit with them or talk with them on the phone to be the mediator
That's right.
between visitation
Mhm.
and then telling and explaining to them what their family member was dealing with.
Mm.
That would, I mean, we couldn't help, but we would be crying
Oh, it's
right in front of the patient, and then you watching their breath just come up and they turn blue, and it was just unbelievable. It was unbelievable.
Stuff. It was hard.
Yes, it was.
Today, best advice to everybody who's watching and listening about COVID prevention moving forward. Your best thoughts to them.
So the first thing I think is know what your risk factors are for getting an illness. So are you older? Do you have these comorbidities? I didn't actually even mention asthma, COPD, all that stuff, respiratory things. These are things. So know what your risk factors are. Make sure you manage your risk if you're going into a high risk situation. Think about, should you do it? I mean, if somebody's coughing in front of you, get away from them. Simple things like that. Outside, probably not such a big deal. Inside crowded spaces, perhaps you need to really, make sure you're careful about things. But we've kind of moved to a different phase now. The scared phase, where it was just happening all over the place when people were dying, is kind of, we've moved on from that, but we still have it. It's here, and that you want to make sure you protect yourself, protect your loved ones. When there is a vaccine that comes out, so September, October, there's going to be another vaccine that's active against things. Along with your flu shots, you take this one, and that'll be something that you'll need to do. So managing your risk, understanding what it is. Younger people fare a little bit better than older folks, but you need to make sure you take care of yourself so that you can do it. We've now transported it from having a terrible ICU death to now almost like a cold that may be a little bit worse, which is better than it was before.
And I assume you're gonna say exactly what you said when you were in here, what, two or three, well, weren't in here, but on the Zoom with us then. Get vaccinated.
That's right.
Get
Always get
vaccinated.
vaccinated.
Get vaccinated.
The side effects are small. Think about all those people got 150 million people got vaccinated, and you don't hear like mass hysteria about people having complications from that. And when people get worried because they've heard this, they heard that, and we are susceptible, unfortunately, to hysteria now because of what's going on in social media and other things. Just sort of
Social media.
It can drive you crazy.
Yeah. Really want to thank you for not just for tonight, but for the whole, you've been with us the whole time. When this first thing started, COVID came out, I said, oh, I need some, let me call Dr. Campbell. Oh yeah, Dr. Campbell. And he's been with us, man. I don't remember the first time you popped on the Zoom with us to give us, you guided us through this whole thing, and you never say no. And but I understand you're a doctor and you're trying to keep people alive. We're trying to keep them alive and free. You're trying to keep them alive and literally alive.
Literally alive.
That's what we're trying to do.
I just want to tell you this, Mike.
Yes, sir.
He's been in a bunch of places lately. I mean, look, I'm surprised we got him tonight, right? He's been in New York. He's won an award. I mean, every time I turn around, you winning some award. What's all that, man?
I've been fortunate. I mean, we were talking earlier.
You think? You think? I mean, you have been fortunate.
I've been fortunate. I've been fortunate. So I was just down in Brazil. I became an honorary fellow of the Brazilian College of Surgeons, which is exciting. Had a chance to go down there and do that, and then been other places this year. Did some teaching in Cuba. Been to some other meetings.
Cuba has is it true that they have I know they have a great educational system, but their health they're very healthy. Cubans are very healthy, right?
First of all, they take care of themselves. First of all, the people are wonderful.
Got you.
Yeah.
Great food, music, food, the whole thing. But people who live there are suffering, and because they don't have enough things. I mean, that's really what the problem. The infrastructure is poor. The hospitals don't have all the equipment that they would have here. Now, they really do a great job with primary care, making sure people are taking their medication, that kind of stuff. But simple things like you can't go to the store and get something, get stuff on consignment and that kind of stuff.
Got you.
With it. So, but, people are wonderful there, with us. I was teaching a course on trauma to a bunch of people, and that was really fantastic.
Gotcha.
So I got a chance to do that.
Gotcha.
He didn't give you all of them because probably he's gonna run out of time to give you everything because he's really and lauded and beated and FEETED. I never understand that word. But Mike, I think the thing that's what brought me into when I first met him was that I mean, we talked earlier about the violence in Jacksonville, and we talked about the gun violence in the United States and so on and so forth. My first introduction to him was, this is the brother. When brothers get blown up on the street, this is the brother that stitches them all together.
Okay.
This is the brother that stitches them all together. And that was, and I know
we have seen some of his work.
Yeah.
Where he's taking out poles.
Yeah.
Bullets.
Wow.
Yeah.
Yeah. Some of the most incredible surgeries you can imagine, and they survive.
Isn't
some dudes that that been popped,
man,
they owe their life to this brother. Okay.
Yeah, I've operated now, and because I've been here a long time,
it's not nothing to laugh at, Dr. Marshall.
I've operated entire families, uncles, brothers, sisters, mothers. I mean, so I've operated on a bunch of people. So because I've been here a long time, trying to do what I got to do.
Well, thank you for everything.
Well, thank you.
Thank you.
No,
a
seriously.
rare and singular individual and man,
and then his willingness to share, the guidance, the wisdom, the instruction, and the process.
Yes, ma'am.
And he's always available to do that, working with young people who are interested in going into that. So he's just amazing, and we do treasure you.
We have folks who want to get into the medical field, and he's like, okay, send them this way. I'll do what I can to move them along. Doc is a doc.
Well, you're a doctor too.
You ain't saving
He ain't
lives
thinking
like
about
that.
no bullets, baby.
It was like blood. No, I'm just
Different type of doctor.
There's a lot-
How-
and there's a lot of-
Dr. Campbell, how do you deal with that? Because
Deal
the
with.
redness of the blood,
Oh, okay.
it's nothing. You can't mimic that red. And when I seen it,
You pass out, right?
oh my, I almost passed out. I almost lost my life.
Well, the reality is when you first see it, it's kind of scary, but then after a while you get used to it.
Got you.
Right. And sometimes there are medical students who may not be used to it. They
I got
they
my
can-
blood drawn, right?
Yeah.
And
That's
you
right.
passed out.
I almost passed out. Dude was like, "You need some water? What do you need?" I was like, "Man, I'm not gonna smoke because I smoke weed. I'm not gonna smoke. I'm not gonna do nothing for 24 hours. I'm gonna drink all the water I can. And next time I went in, it was a piece of cake after that. But the first time I went in, he was like, "It's not working."
First of all, you shouldn't be smoking anything.
Oh, man. Thank you, Doc.
I got to take that opportunity, man.
You didn't tell me that, Doctor.
That opportunity, I'll take that opportunity to say you shouldn't be smoking anything.
I need a prescription. No. I'm joking.
All right.
Yes, sir.
It's an adventure with him every week. Believe me.
I know.
All right. Thanks a lot, Doc.
No problem.
Thank you,
Appreciate
Doctor.
it. Love you,
Thank
man.
you. Thank you,
And,
Dr. Campbell.
everybody, we're out of here tonight. Stay alive and free. Stay alive. Get vaccinated. Get vaccinated. Get vaccinated. And yeah, take care of yourself. We'll see you next week right here, live and free Street Soldiers Radio. Good night.
Thank you for having me.